Good afternoon, and welcome to another Facebook Live Lunch and Learn with the Center for African American Health. I hope that everyone has received their ballot in the mail and had an opportunity to vote, or at least has a solid plan in place to vote. November 3rd is Election Day, so please make sure that you exercise your right to vote. The only way we can change things in our community is by working together. So if you haven't done so already, please sign up for our community information session regarding the Be Heard and Advance Equity in Health Policy event that takes place this Wednesday, next Wednesday, October 28th. The Center for African American Health is partnering with the Colorado Consumer Health Initiative to ensure that you have a seat at the decision-making table when it comes to developing programs that advance health equity in our community. We will provide an Eventbrite link in the chat for this important event that will also repeat on November 5th. As we wait for a few more people to join, I'd like to introduce myself and tell you a little bit more about the Center for African American Health. My name is Deidre Johnson, and I'm the CEO and Executive Director. For those of you who may be unfamiliar with the work of the Center for African American Health, we have been working in the Metro Denver community for more than 20 years with a focus and commitment to improving the health and well-being of the African American community. So as we move through today's session, please feel free to type your questions in the comment area, and we will address them if time permits. Like clockwork, seasonal influenza, or the flu, is returning to Colorado and the nation this fall, while scientists are scrambling to better understand the coronavirus, how it is spread, who's most at risk, how to treat it, and most importantly, how to prevent it. Much is already known about the flu. Even so, it's hard to predict if it'll be a mild year for flu, a severe one, or even an epidemic year. One thing is certain, during a pandemic, no one wants to see a new surge of COVID-19 cases combined with a severe flu season. The two diseases have many similar symptoms, and both increase the risk for fatal illness and overwhelming hospitals and our healthcare systems. Both diseases also continue to have adverse and disproportionate impact on communities of color. Today, I am joined by two guests who can help us navigate the flu season during the COVID-19 pandemic and to discuss the similarities and differences between the two. Please welcome Stephanie Wasserman, Executive Director at Immunize, Colorado, and one of the Center for African American Health's board members, Dr. Oswaldo Grenardo, who practices family medicine at Centura Health. Welcome, Stephanie and Dr. Oz.
Good afternoon.
Thank you so much for having me here.
So before we jump into the discussion today, I'd like for each of you to provide our viewers with some information about your professional background and your respective organizations. Let's start with you, Stephanie.
Thank you so much, Deidre. As Deidre mentioned, I'm the Executive Director of Immunize Colorado, which is a nonprofit that was formed more than 30 years ago to address Colorado's bottom in the nation childhood immunization rates. And since then, we have effectively worked with healthcare providers, families, children, schools, and communities to improve immunization rates to protect Coloradans from the devastating consequences of vaccine preventable disease.
Thank you.
And I'm Oswaldo Grenardo. I'm a family medicine doc native to Colorado. I am also a medical director for Centura Health. And Centura Health has a mission to deliver really whole person care to all Coloradans. We're in all throughout Colorado with hospitals, neighborhood health centers, a network of physicians and mountain clinics, as well as diagnostic imaging, senior living centers, ambulatory centers, and also in Western Kansas. So we're excited to be here today to talk about this incredibly important subject.
Thank you. So unfortunately, Colorado's COVID cases continue to spike as we enter the cold and flu season. Let's start by talking about the flu shot. Stephanie, when is it technically too late to get a flu shot?
That's a great question, Deidre. Thank you. It's technically never too late to get the flu shot. The flu season typically starts around now in the beginning of the fall late September, early October, and runs through May or June. So as long as there's vaccine available for each flu season, you are encouraged to get vaccinated. The truth is, healthcare providers really want you to have a vaccine by Halloween, and that will give you the full protection against the circulating virus for the current year, and that it can take up to 2 weeks for you to build up the antibodies once you get the vaccine. So earlier in the season is better, but it's actually never too late.
Good to know. So Dr. Grenardo, I've heard many people complain about getting the flu vaccine and then getting sick immediately after. Can you explain why some may have this experience?
For sure. So there are some patients, when they get the flu vaccine, they will experience some type of reaction. The flu vaccines that we're using right now that are injected are ones that are not live. So we are using immunizations that when they go in the body then recognizes them as foreign, and then the body then has a reaction to making antibodies to it. What some people experience is when that vaccine goes in, the body may have an overreaction to it, making them feel not well or ill, but they don't get the flu. So that's the big point, is their body is just reacting to the immunization itself, and they don't actually have the flu. So that should resolve within 1 to 2 to 3 days, and typically it's not problematic. There are a lot of people, though, who may have had the immunization once and then had this reaction and then said, no, I'm not going to get it ever again. I'd encourage everyone to certainly reconsider that if you've had an issue with a shot before. The batches are all new each year, and so I'd want you to think about strongly getting one this year, because the reaction that you had previously may have been specific to that year and that batch, and it's unlikely that you would have another similar experience.
Thank you. So one of the unique challenges for this year's cold and flu season is being able to differentiate between a common virus and the novel coronavirus, which causes COVID-19. Dr. Oz, can you help us distinguish the symptoms?
I can't. This is the hardest thing that docs have to do. And for us, the symptoms are very similar, very similar. And so with both being viruses, coronavirus and the flu virus, they produce almost all very similar symptoms together. So you can have fevers, chills, cough, shortness of breath, fatigue, sore throat, runny nose, muscle pain, body aches, headaches, and some people will even get vomiting and diarrhea. So the issue is, as a provider, it's very difficult for me to distinguish between whether or not you have a regular common cold virus, the coronavirus or COVID-19, or the flu. And so we have some ways that we can detect which is which, but based off symptoms, it's very difficult. Sometimes if someone has either loss of taste or loss of smell, that's more indicative, we've seen, of having some type of COVID-19 or coronavirus infection. That's really, for us, and my particular really only way to distinguish between having one or the other.
So what happens if you start feeling sick? When should you seek medical attention?
So this year, different than many other years where we say, you can wait 3, 4, 5, 6 days, see how you feel, see if you get better. I'd really want to encourage patients and people who are watching or listening, and certainly their family members, to get care early. So 1 to 2 days into an illness that we just discussed in terms of having those symptoms, I'd want you to consider going to see someone. We've got ways to do rapid testing for the flu, rapid testing for coronavirus, and those are being implemented in a variety of different places and clinics throughout Colorado. There's also ways using the same swab or using a different swab, but in the same setting, to detect whether or not someone has strep throat. So there are some clinics that have it, some that don't, but certainly this year, we'd want you to come in sooner rather than later so that we can give you guidance if you have some type of illness and you're having those symptoms about what you can do without prescription meds, but then also what things that we can prescribe to you if in fact we can hone in or identify what you may have.
Thank you. So Stephanie, families are going to be spending much more time around each other than they normally would. Kids are learning remotely, parents are working from home if they can. What advice can you share on maintaining a healthy space in close quarters?
Yeah, so this is really a critical question during a pandemic. We are being told by public health officials over and over again the importance of hand washing, maintaining social distancing, and wearing masks. And we're entering into the season of when we are celebrating holidays with family and friends. And in Colorado, we've been so fortunate to be able to do a lot of things outside in the summer when the weather's beautiful. Now that it's cold, everything's kind of moving inside. And so we're very concerned about not just protecting families in close quarters from COVID, but also making sure that people are protected from flu. And the thing about flu is that it affects people of all ages, but some people, such as older people and young children and people with certain health conditions, are at higher risk of seasonal flu. So getting a flu vaccine has never been more important this year, because last year when we weren't in a pandemic, about 3,500 people in Colorado were hospitalized during the flu season last year. And unlike COVID, children actually had the highest rate of hospitalization. Last year, sadly, there were 3 pediatric deaths in Colorado of children less than 18 years of age. So if you have people gathering for the holidays in your home, please encourage people to get a flu shot. Last year, only about half of Coloradans received a flu vaccine. They're readily available at a number of places across Colorado, including pharmacies, your pediatrician's office, and many pop-up community immunization clinics to address what scientists and public health officials are hoping to avoid, which is called a twindemic. So we have—
Now, there is a plan to distribute a vaccine in Colorado when one—
Go ahead, Stephanie.
Yeah, so basically, it's just really important to maintain those public health practices when you're gathering at home, and also to have everyone gathered at your house to get a flu shot. You can get a flu shot as young as 6 months of age. Thank you.
Thank you. So I have a question I'll ask now before the one I was going to ask you that actually came in. Some people have concerns about the safety of the ingredients commonly found in vaccines. Can you tell us more about this specifically in the flu vaccine?
Stephanie, please.
Yeah, so flu vaccines have been around for years and years. Every year a new vaccine is developed based on the different viruses that they think are going to be circulating by observing what happens in places like Australia when they have winter and we have summer. And they're very, very safe vaccines. You are much more at risk of having health complications and including death from the flu than the typical mild symptoms that you might get from a vaccine. And we have a very robust vaccine safety system that monitors every person who receives a vaccine for effects. So ingredients are well tested. We have a robust vaccine safety system. And just like all ingredients in medications, they are thoroughly tested and vetted through our scientific processes.
And Stephanie, you know, I have some patients who will ask me, Oh, I've heard that this has got so much mercury in it. I don't want to take it. Can you talk specifically about mercury or that in some of the more common immunizations?
Yeah, so the mercury that used to be in vaccines is different than the mercury I think that is found in like other kinds of products. And it in very small amounts, it used to be in vaccines as a preservative. Out of an abundance of caution, it has been removed from vaccines since 2000. There's still in some multi-dose combinations of flu vaccines, there is still some, but you can request a mercury-free flu vaccine product.
Great. I've never seen an issue with that, but I know that there are some of my patients who will ask, and we'll talk about just that
Yeah.
it's either have been eliminated or they're so small in what you're actually getting that certainly it's less than what the EPA wants in terms of levels of where it should be at than if you were to get just fish in from the supermarket.
Right, and the type of mercury is actually, the amounts are more, you get a bigger dose through breastfeeding than you do through a dose of a vaccine.
Yeah.
So, yeah.
It's also, from what you're saying, Stephanie, it's also nice to know that folks didn't come up with a recipe and then just leave it on the shelf and do the same thing, but they're constantly revisiting and refining.
Yes, yes, we have a really robust vaccine safety system that studies vaccines through clinical trials. I'm sure that you've heard about that with the development of the COVID vaccine. And once they are on market, they are monitored very closely for everything from mild effects to serious effects, which are very rare in the case of a flu vaccine.
Again, that's why I want patients to consider getting a flu shot, again, especially this year, just because of that constant improvement of the vaccines and really focusing on side effects and how effective it is. That has changed over the years, and if people haven't gotten one soon or recently, I certainly want them to think about getting it strongly again this year.
So speaking of COVID, we know that eventually a vaccine for COVID-19 will be available to the general public, but the timing and distribution are unclear. I'm sure you both have heard information. Can you share what you know about distribution in Colorado? Let's start with you, Dr. Oz.
So I saw an article probably last week that Colorado had submitted our plan to distribute the vaccine when it becomes available. We thought that through an emergency act that we could actually, or approval, we could actually get one by the end of November. And as some others may say, sooner than that. So the thought process is that once it's available within the next couple months through next year, that likely those doses will be distributed to healthcare workers first and essential workers, as well then as the next stage being then those essential workers who didn't get it the first time, and then after that to the general public. Very difficult subject because I, as a provider, want to make sure that I see what the numbers look like. I know that Black people have been represented in those trials and making sure that they're safe. The difficult thing will be we're only dealing with a short amount of time for those vaccines to have been studied for the side effects that they're giving. And so my concern with something that's new is how effective is it? And then what are the side effects? We won't have a lot of that long-term data. And so I think a lot of us will be talking about, is it worth the risk to do it? I think it likely will be, but we'll have to see what the data looks like first.
Thank you.
Yeah, thank you. And the COVID development of a COVID vaccine is in the news every day. And if we listen to the scientific process and the scientists, it's likely there will be a COVID vaccine available in limited quantity in the next couple months. And there has been this process to prioritize different populations that Dr. Ozzie was mentioning. But as we sort of follow the scientific process and listen to the experts, eventually, you know, there will be a vaccine available for everyone. But the first few rounds of it will be available in limited doses. And what's been really important for us to look at is how to get that out to prioritized populations. And that is like essential workers, as Dr. Ozzie has mentioned, seniors, those that have been so adversely affected by COVID, those in nursing homes and assisted living facilities, and then eventually out to the broader public. But just like with COVID, we do know that people of color have been more adversely affected by COVID and with flu as well. And for example, in the last 10 years, we know that African Americans have had the highest flu-related hospitalization. So it's really important with COVID that we listen to the scientists and make sure that we have all the tools in our toolbox to address historical disparities in vaccination coverage rates and disease burden outcomes, which sadly we're seeing every day in the news related to COVID. But we can do something about that with flu by ensuring that everyone gets their flu vaccine this year.
And Stephanie and Deidre and I have talked about representation of the Black community, African Americans in these trials. So, you know, it'll be important, I think, for all of us to really push for that and make sure that there's good data on how are these affecting our community when people are going through these trials. And so if there's not that data there, then, you know, I want to make sure that we are then, as Stephanie said, listening to the scientists and making sure that it's safe and effective for everyone. But having that specific data on how it's affecting the Black community, to me, is going to be incredibly important as to my exhilaration or excitement about getting this for our community, or being slightly more hesitant. But as Stephanie said, we know the numbers for the flu, and we know how devastating that's been or can be for our population, and even more so with COVID-19. Lots and lots of statistics of how we have been overrepresented in the number of cases based on population and the number of deaths based on population, almost double of where we are represented as a population in Colorado. So when that comes out, it's going to be critical for us to take a really good hard look at what can we do, can we get this, is it safe for us, and then hopefully moving forward with getting those if they've been proven to be safe.
So Dr. Oz, is it possible to have the flu and COVID-19 at the same time? Yes, unfortunately. Similar to if you have one virus that has affected you and then you get another. There's no protection by having one or the other. The best things that we can do certainly are social distance and wearing masks. So if we're doing that and staying in well-ventilated places and taking some of the advice, just practical advice of the CDC, we can hopefully prevent that, as well then as importantly, using that immunization for the flu to protect you against that and decrease your risk of getting it, but then also decrease your risk of having a bad illness from that. It'll really mitigate or bring down the symptoms if you were to actually get the flu, if you've had that flu shot. But you can, and that's the thing that we're concerned about. As Stephanie said, that twin pandemic or twindemic is really having patients who have both, which can be certainly devastating to those who have who are at higher risk, and especially those who have lung issues. Thank you. So Stephanie, you mentioned earlier about the many places we can go to get a flu shot. If someone's considered a high risk category for COVID, they may be concerned about actually venturing out even for a flu shot. What are some of the safest ways for people to get vaccinated?
That's a great question. Yeah, in this difficult, challenging environment we're living in, there are people that are staying at home full time and trying to really avoid leaving their homes, especially if they have underlying conditions, but there are many ways that you can still get a flu shot and stay safe. Healthcare practices have done a tremendous amount of work to make sure that their office settings are safe by implementing social distancing, appointments and waiting rooms that are safe and allow for social distancing. And then there's also pharmacies and local public health departments and some other kind of retail agencies that are offering things like drive-through immunization clinics. Some innovative activities are happening across our state where they're actually, some local public health are providing in-home immunizations. And I encourage you to go to flufinder.org, which is available on the health department's website, to look for the variety of different ways that you can get a flu vaccine that you're comfortable with. There are lots of different opportunities. And in terms of cost, there should be no barriers around cost. Your insurance will cover it 100%. And if you are uninsured, your local public health department offers a free vaccine for anyone who is uninsured or underinsured.
Thank you. In fact, along those lines, the Center for African American Health is hosting our next drive-through flu clinic on Friday, October 30th. So just in time for that get it by Halloween deadline. It'll be from 9 a.m. to 1 p.m. at our office located at 3350 Hudson Street. Community members will be served on a first come, first served basis. This will actually be provided to adults only. And as mentioned, insurance will be billed if you have it, but if not, they're free of charge to anyone in need. And I want to thank you both, not only for carving time out to chat with us today, but for what you do on a daily basis, especially during this time.
Well, thank you so much.
Well, the center has been fantastic in providing not only COVID testing, but now these flu shot clinics drive-through. It's great to be a part of an organization that's really reaching out to our community to make sure that they're protected as well as they can be.
Thank you.
Yeah. Yes, and thank you so much, Deidre, for having me. And your organization is such an important organization for all the work that you do, and this really important time of reckoning around historic and racial biases. And you have so many important strategies and focuses on addressing and correcting all these issues that we're reckoning with right now.
Oh, thank you. Thank you. So thank you all for joining us this afternoon. As usual, this video will be available along with other information on the center's website, caahealth.org. Again, thank you for tuning in today. Join us next week for a Facebook Live Lunch and Learn discussion with Kevin Patterson, the CEO of Connect for Health Colorado, regarding health insurance and open enrollment, which is just right around the corner. Thank you.
Thanks.
Thank you.